Hello everyone, welcome back. Today I'll be covering regarding a spinal shock. It is among the part of my exam question. I hope this video will help you during your exam too. Okay, now let's begin. What is shock? Shock is an acute circulatory failure, the essence of which is failure to provide tissues with adequate oxygen, leading to cellular hypoxia and organ dysfunction. Shock resuscitation increases the oxygen delivery to the tissues and organ by improving the tissue perfusion. What is definition of spinal shock? Spinal shock is characterized by temporary reduction or loss of reflexes below the level of spinal cord injury. It is characterized by flaccid paralysis, loss of reflex activity, anesthesia, absent bladder and bowel control. What are the phases of spinal shock? Phase 1 started 0 to 1 days. Patient has areflexia or hyporeflexia. This is due to loss of descending facilitation. In phase 2 occur within 1 to 3 days. There is an initial reflex return due to denervation, supersensitivity. Phase 3 of spinal shock is within 1 to 4 weeks. There is an initial hyperreflexia. This phase is due to axon-supported synapse growth. Phase 4 that occur within 1 to 12 months. Final hyperreflexia. This is due to some supported synapse growth. What are the differences between the spinal shock versus neurogenic shock? A. The definition itself. Spinal shock is a temporary suppression of all reflex activity below the level of injury. But for neurogenic shock, hemodynamic instability caused by loss of sympathetic tone and catecholamines is one of example of distributive shock. B. Location. Spinal shock can occur anywhere on the spinal cord region. But for neurogenic shock, usually it occur above the T6 level injury. C. Systemic hypotension. In spinal shock, it is possible. It might be present or absent. Once the bulbar cavernosus reflex returns, the spinal shock is usually over. Patient does not have bradycardia. But for neurogenic shock, systemic hypotension is present. Usually, they present with hypotension due to massive vasodilatation, bradycardia due to unopposed parasympathetic stimulation, and poikilothermia, whereby patient unable to regulate temperature. D. The onset. Spinal shock usually occur immediately and sometimes up to days. But for neurogenic shock, immediately is usually occur within the first 30 minutes. And the duration of spinal shock usually lasts days up to few months. But neurogenic shock usually lasts up to 6 weeks. What are the vasopressor used in spinal shock or neurogenic shock and why? Remember, maintaining adequate perfusion pressure to the spine is crucial in patients with spinal shock to prevent secondary ischemic injury. Recommended to maintain a mean arterial pressure MAP at 85 to 90 mm mercury for the first 7 days after an acute spinal cord injury. Proper fluid management is necessary to avoid fluid overload and edema. Study shows patients with spinal cord injury improve spinal cord perfusion with norepinephrine and better side effects tolerance compared to dopamine. Midodrine and desmopressin has been shown to accelerate the liberation from IV noradrenaline in patients with spinal shock and effectively reduce the length of stay in the intensive care unit. Other management in a spinal cord injury. Profound bradycardia can be treated with atropine and temporary pacing and usually seen in patients with high spinal cord injury. Spinal cord injury can develop venous thromboembolism (VTE) within 72 hours of admission. Thus, patients require VTE prophylaxis. Patients with spinal shock will usually develop paralytic ileus and require decompression. When this resolves, enteral nutrition should be started. Prevention of pressure ulcers by adequate turning and positioning. Urinary catheterization is necessary due to urinary retention. However, intermittent catheterization is preferred over indwelling catheters to decrease the risk of catheter-associated urinary tract infection (UTI). All patients with spinal cord injury should receive gastric ulcer prophylaxis with proton pump inhibitor for 4 weeks. Yay! We have reached to the end of this video. See you in the next one. Take care and bye.